I'm Dr. Jen with White Wave Bodywork, and in this video what I want to talk about is stretching the hip flexors during pregnancy. So our hip flexors are a series of muscles or group of muscles that literally flex the hip. So this position that I'm in here, my hips are in a neutral position. In this position, they're flexed. Anytime my chest comes down toward my feet, my pelvis comes forward into this angled position, or my knees come up toward my chest, that is hip flexion, right? When we are pregnant, the hip flexors are put into this position because our center of gravity gets pulled forward a little bit. It gets put into kind of a shortened hip flexion position where we really have to work hard to tuck and pull away from that action. So these have a tendency of getting tired and tight. Typically how I would describe how to stretch that would be in a standing position on one foot and pulling the knee back. Like that's how we stretch the quads a lot of the times. But it doesn't really get the hip flexors as much as it could, and it puts us in a position to stand on one leg for a prolonged period of time, which can both have their issues during pregnancy. So I'm going to show you a couple different positions to stretch out the hip flexors while you're pregnant. The first one I'm going to show I would call the easiest one, and that is in side lying. So I'm going to take my pillows and position them so that I can lay down on my side. So these two pillows are going to go up underneath my head, and my shoulder is on the floor. And the bottom leg is going to come knee up towards my chest, and I'm going to hold on to it with one leg, or one hand. Bottom knee held with one hand. From here, I'm going to take the top leg back. So I am stretching out my quad very similarly to how I would be in standing, but I don't have that pressure through one leg. So in this position, I can feel a stretch on my quad. What I'm going to do now is take my pelvis and tuck it back, almost like I'm trying to do a tiny little crunch in this position with my pelvis. So I'm taking my pelvis and I'm maybe even squeezing my butt cheeks together to get the pelvis to come forward, or flattening out my lower back. Now while I do that, the knee wants to come forward with it. So I'm going to try to invite my knee to come back as far as it can as I pull my heel towards my backside. I'm going to take a couple deep breaths here and keep trying to tuck that pelvis forward, or tuck the pelvis to flatten out the lower back and pull the knee back toward the back body. So I'm stretching out the top leg hip flexor in that position. If you want to take it a little bit of a step farther, what we can do is, now my knees are sensitive during pregnancy, so what I like to do is kneel on something a little bit softer. I'm going to take one knee on top of the pillow and the other leg in front. So from here, I'm going to do that same tuck of the pelvis. So I'm getting this dip out of my lower back. So I'm going to tuck here, get the dip out of the lower back, and then shift forward. I can really feel that pull up through my abdomen and in through the top of my leg. And I just want you to only go so far as it feels comfortable. This muscle is so tired already. We don't want to be overstretching it because it has so much fatigue due to all the pressure here. Want to have a lot of respect for the hip flexor, but we also want to invite it to elongate a little bit, because it can be what can cause our low back pain or our groin pain, our pubic bone separation. Like all of that feeling of discomfort can be coming from the tension in these muscles. So it can be a really, really powerful, helpful stretch to do during pregnancy. I'm going to switch legs so you can see it a little bit differently. I'm going to shift my weight back, get that dip out of my pelvis, and shift forward. Now, if I don't do that tuck, I can come forward all day, and I'm not gonna feel a whole lot of stretch. If I do the tuck, this is as far as I go, and I feel it in a completely different place. So that's, the pelvic tilt is the component that's the most important for this stretch to me, to really get it in the right spot. One more time, I'm gonna switch positions just so you can see. It's nice to have something to hold on to near you. So we unplug the hips by shifting them back, tuck, come up nice and tall, and then shift the weight forward. And that's enough for me. It's not a big movement. It's not a very large movement. It's just to get this pull feeling up in the top of the hips and in through the thighs. All right, I hope you found that helpful. We're trying to stretch out the hip flexors during pregnancy. If you have any comments for me, please send me a message or leave a comment in the comment section below. Thanks for watching. Make it a swell day.